We are continuing to follow breaking news this morning as Pfizer says its experimental COVID-19 pill, it cut hospitalizations and death by 90%. So joining me now is the city's new health commissioner, Dr. Cheryl Bettigole. Congratulations on that being official, and we'll talk about that in just a second. But we want to get to this breaking news because this really could change the game when it comes to treating COVID-19.
Yeah, this is really exciting. It's very preliminary. It just came out, so none of us have seen the data ourselves. But what they're saying is that, close to 90% efficacy in treating COVID among unvaccinated people who are at high risk. So preventing hospitalizations and deaths. And that is really, really exciting. We haven't had an effective treatment. There's one other pill in the pipeline. I shouldn't say we haven't had an effective treatment. We haven't had a pill.
Yeah,
so
the pill form.
It's good news.
And I know we don't know a lot of details yet, but essentially it'd be just like anytime you have a sinus infection or if you're sick, you go to the doctor and the doctor says, hey, let me prescribe you something.
Well, hopefully we're not treating sinus infections with antibiotics or antivirals, but for this, again, it's too early to know exactly how it's going to be used. But to have an effective pill rather than an infusion where you have to go to an infusion center, this is exciting.
Okay. Yeah, I was just trying to give an example there, but of course you would know more than me about how to treat certain illnesses, so forgive me on that one. Let's talk a bit about kids' vaccines. We know now that it's been approved, we're ready to go. So how's it going to work for Philly? How many is Philly getting?
So our first order, and it's really just a first order, is 20,000 doses. And many of those have already arrived in the city. Some have already been given. It's rolling in waves. So I know there's a certain amount of frustration among people who haven't yet been able to get an appointment, but it is coming in and we are anticipating having enough vaccine for everyone.
Okay, yeah, I was going to bring that up next, that some people were saying they're having trouble. What recommendations would you give them then if they're trying to get that appointment and they're having trouble getting one? I
would just give it a few days and try again. Some of the places that are planning to give pediatric vaccine didn't get their orders yet. And some were cautious about scheduling appointments because they weren't 100% sure they were going to get their orders. So, hopefully by next week, things will be running smoothly. Just, wait a few days and try again if you haven't been able to get that appointment.
Okay, that's good to know. And when it comes to vaccinations in general, though, what is the latest when it comes to adults as far as how many, what percentage has been vaccinated in the city?
Yeah, so we're making good progress. Our adult numbers have been excellent. For 1 doses, we're at 87.8% of adults, 81.4% of 12 and over. And then for fully vaccinated adults, we're at 71.7%, 66.4% for 12 and over. So really good progress, and yet still thousands of people in the city who we still need to reach.
And I know for when it came to adults, and this was a while back, but there was a threshold that we wanted to at least we could, relax a little bit when it comes to COVID and how that is. Is it going to be the same with kids? When it comes to our schools and all that, is there a certain number or is there a certain goal that we're hoping when it comes to percentage-wise for kids in the area?
So for the health department, we've been pretty consistent that we want to reach everybody. There has been this idea floating around nationally of herd immunity and various numbers floated. But it's pretty clear if you look around the country that none of us are at or really near herd immunity. So, I don't want to set a number. We really want to try to reach everybody with this vaccine.
Okay. Because meanwhile, we're getting colder. Folks are going to more indoor events and doing more indoor things. How is it when it comes to numbers? Are we seeing any uptick from, for example, we have the, lots of Sixers games and Flyers games, and people have been, even though there's a system set up and people are wearing masks or encouraged to, are we seeing any type of uptick at all?
We are not in Philadelphia. Our numbers have been falling. And that's been really good to see. And I think that's a testament to how Philadelphians take care of each other and mask wearing. I will say I watched a basketball game. I was underwhelmed by the number of people who actually had their mask on. Please keep your masks on, folks. But if you look around the country, especially at places that have gotten cold before us, their rates are going up. And there's actually an uptick in some of the surrounding counties. So I think we really want to be cautious. If you are gathering with other people indoors, make sure they're vaccinated. Try to keep the numbers down. The more people indoors, the more likely somebody might have COVID and be able to spread it.
Okay. Thank you for that. And lastly, congratulations. I know you've been in the role for some months now, but now it's official.
Yeah, thank you. It's exciting. It means we can move forward with longer term planning, some projects we really wanted to get off the ground. So it is exciting.
Well, let's talk about then, I mean, your name is Bettigole. So what is your #1 goal in this new role?
I never thought about that before. My #1 goal is equity and really imbuing all of our work with equity. And that's something we have strived for a long time. But I think, one of the things we've really learned from the pandemic is that has to be front and center in all of our work, because there's so many forces in our society that push away from equity, that if we're not designing everything with equity in mind, we will miss the mark.
Okay. Well, thank you so much. We appreciate your time, and I'm looking forward to continue to work with you as we get the information out there to keep folks safe and healthy.
Thank you so much for your help with that.
Okay. Thank you so much, Dr. Bettigole, officially our new health commissioner for the city of Philadelphia.